Our next speaker is Dr. Claron Aldridge. Dr. Aldridge is a Utah native and an ophthalmologist and a retina specialist. He's the chairman of the Division of Ophthalmology at LDS Hospital. And he's a member of Utah Physicians for a Healthy Environment, which is an activist group fighting to educate Utahns about the health effects of pollution and to clean up our air. So let's welcome Dr. Aldridge up here.
Thanks, Matt. I'm here today representing the Utah Physicians for a Healthier Environment. The UPHE is the largest civic organization of healthcare providers in Utah with over 230 members. Primarily we're physicians, but we also have other healthcare professionals including biologists, toxicologists, engineers, air quality specialists, and the general public. And we are concerned about the health risks that are present in our environment. Our concerns are based on overwhelming and convincing evidence in the medical literature demonstrating a wide array of chronic diseases that are more common in those who have more exposure to air pollution. If you want to find out more about those negative health consequences of air pollution, visit our website at www.uphe.org. The air quality on the Wasatch Front is a public health crisis. This is not a partisan issue. It is a public health issue. Economic development is important, but no economic gain is worth the negative health consequences that air pollution exacts from the people. Our poor air quality detracts from the aesthetic beauty of our state and from the attractiveness of the economic situation here in Utah. We cannot exchange short-term gains in economics for the disasters that will ultimately befall us. During the winter, our temperature inversions are bad enough that our air quality along the Wasatch Front in Ogden, Salt Lake, Orem, Provo, and Logan often puts us among the 25 worst air polluted cities in the United States. Often we have the 5 out of 5 worst cities at any one time. I became concerned about this issue after returning to Utah. As Matt mentioned, I'm a Utah native. I grew up here. I spent about 10 years living in the Midwest and working in the Midwest, and when I came home to Utah, I found that the air quality was much worse in the summer. We always talk about the winter. Well, we've had these temperature inversions my entire life, but I couldn't believe how much worse the summertime air quality was. I wrote my state representative, told him about my concerns, and he wrote back and said it's no worse than it was before, and it's just the challenge of the geography that we face. We're just going to have to put up with it. Absolutely an unacceptable answer. Our ancestors, the pioneers who colonized this region beginning in 1847, found geographic challenges, and they didn't turn tail. They didn't just give up to some inevitable defeat. They dug in and made it work here. Water is the most obviously limited resource in this area, but our airflow is also a considerable concern. We don't have enough airflow to just waste it on pollution-creating energy resources. Our poor air quality poses a significant threat to our health. Current estimates are that air pollution decreases our health to the point that we lose 2 years of life because of our air pollution. Compare that with 8 years of life to smoking a pack a day of cigarettes. So it's just 1/4 as bad as smoking a pack a day of cigarettes to have our air. There is no safe level of secondhand smoke, and there is no safe level of air pollution. Utahns have long avoided the evil of smoking. our air pollution problem is at least as evil as secondhand smoke. We were among the first to pass indoor clean air acts. We need to clean up our outdoor air now. Air pollution has been credibly linked to hypertension, cardiac arrhythmias, heart attacks, strokes, pneumonia, asthma, lung cancer, bronchitis, sinusitis, dementia, multiple sclerosis, autism, Parkinson's disease, lower intelligence, poor motor function, attention deficits, and behavioral problems, birth defects, neural tube and cardiac birth defects, preeclampsia, intrauterine growth retardation, premature birth, low birth weight, infertility, and many others. From a medical and health standpoint, we can't do it anymore. Even low-level exposure is bad. The Division of Air Quality takes pride in saying that our air quality has gotten no worse over the last 10 years. That's saying it's no worse than we're still smoking 10 years later. We must stop this now. We need the cleanest vehicles. We need tighter emission control. Most cars in this country are made in two versions. One for New York and California and one for everybody else. We get everybody else. We need the best. You might think we can't really make much change. You might think individuals can't make much change. Let me tell you about my neighbor. Neighbor across the street put solar panels on his roof. He currently provides all of his electricity for his home and enough to charge his home-built electric car. The cost of his energy to him over the time of the panels is $48 a month. Who here spends more than $48 in electricity and gasoline right now? That's everybody. We could all use, that's what cheap electricity is, let me tell you that. Thank you very much for your time and attention, and let's get this air cleaned up.